Throughout history, the heavy hand of statism has left an indelible mark on public health. From ancient civilizations to modern societies, centralized power has often led to unintended consequences in healthcare. Our presentation, Health Revealed, explores this provocative question. Is statism a significant cause of illness and death? We'll journey through time, examining how government policies have shaped health outcomes. We'll uncover surprising connections between authoritarian control and public health crises. We'll also explore innovative and pioneering ways forward. Learn about decentralized healthcare models that empower individuals and communities. Discover how free market approaches can drive medical innovation and improve access to care. We'll examine successful case studies of bottom-up health initiatives that have transformed lives. Health Revealed isn't just about diagnosing problems. It's about healing our world. We'll discuss practical steps to foster a culture of personal responsibility and community support in healthcare. Join us as we reimagine a healthier future built on freedom, compassion, and human dignity. This presentation will challenge your assumption and inspire new ways of thinking about health and governance. Please don't miss this opportunity to be a part of a vital conversation about our collective well-being.
Welcome to Health Revealed. Thank you for joining us. I really appreciate you taking the time and attention to watch this seminar that we spent a great amount of time doing. We care about this information. We care about what we have to share with you. We care about the world and the medical community. We want to help your practice, your patients, your clients, and the people out there. We believe we have information that is very pertinent to what is going on, and we're asking the question, is statism a significant cause of illness and death? This is a psychological analysis of medicine and politics, what you never learned but needed to know to heal the world. I am joined here by Stephanie Moe Davis, Leslie Powers, and Scott Gordon, a great team of folks that I gathered together here to present this information. Say hello, everybody.
Hello.
Hello.
Awesome. And we're going to start with an introduction about who we are and the problems that we face, so we know what we are dealing with before we move forward. This is a problem that we are addressing that is more than mere conformity, a superstition pervasive through both medicine and society. We are four diverse individuals from different backgrounds coming together in the spirit of care to address this critical issue of freedom and health for the betterment of humankind.
And I want to welcome the beautiful and intelligent Leslie Powers. She's a clinical social worker, clinical supervisor, integrative health consultant, psychotherapist, and philosopher. Thanks, Leslie, for joining us.
Thank you, Stephanie, for that introduction. I wanted to share a little about why this project is so important to me. As a social worker and a clinical therapist for over 30 years, I have personally witnessed my clients suffering as a result of interacting with the health services meant to help them, despite good intentions. And oftentimes, people are confronted with dilemmas and catch-22s, or they're forced to endure demeaning or demoralizing conditions, such as long wait times, rushed visits, lack of thorough individualized assessment, limited treatment options, biased treatment, lack of truly informed care, dropping of or delays in specialty referrals, abrupt cutoffs of medicine or care, lack of integrated services, and lack of access to alternative healthcare options. In addition, our system is weak in its focus on building health and preventing disease. I've seen people get worse instead of better and suffer both mentally and physically as a result. Not only is this traumatic for the patients, but for everyone who witnesses it. This is not about blame. Surely individuals' own decisions that play a part in their own outcomes. And I have great compassion for providers as well as patients, as I've seen their frustration due to their patients not activating positive health behaviors, but instead looking for a pill or a quick fix outside of lifestyle changes. So I am deeply concerned at this time with the state of healthcare in the US due to the increasingly hurtful effects we can witness for both patients and providers. As I study natural law and understand how its principles operate, I clearly see that the current system, which is based on government claims of authority and corporate power structures that are based in coercion and control, that they violate human rights and thus create harm for everyone. And I feel compelled to speak up about this complex situation.
Thank you,
So I'm
Leslie.
glad to be here.
Yes, thank you.
And I'd like to introduce Stephanie Moe Davis, a wonderful friend and beautiful being. She's the co-founder of Awakening Healthcare, patient, analyst, author, experiencer. Stephanie, share more.
Thank you so much, Leslie. And you were so eloquent in your description and introduction. And to parlay off of everything that you already said, I consider myself a part of this project because I am the other end of that which you serve, which is a patient. So I have a 20-year patient experience where I was diagnosed with chronic illness at a very young age that led into organ failure and I was required to have multiple organ transplants. Simultaneously, I had an interesting experience and passion and calling towards Eastern forms of healthcare in terms of spiritual development, psychological development, and really understanding the impacts when somebody does the self work to become self aware. They start to understand their psychological patterns and the symbolic nature of their living experience. So when I was thrown into the healthcare world, as you mentioned, it's not that I don't appreciate and honor everything that they're doing and the advancements that we're making in technology. But what I've seen as a patient over my experience and now have worked with hundreds upon hundreds of other patients struggling within the system is that they are lost navigating the system. There's a lack of psychological nuance. There's a total devoidance of how trauma impacts our health, how our belief systems affect our health, and the ways in which we offer treatment are devoid of true empowerment. So I began Awakening Healthcare as a means to not only educate patients on the multitude of ways that they can address their own psychological patterning and contribute to a healthier mindset emotionally and spiritually. But I had come to realize that the majority of the healthcare providers that I was working under also didn't have this level of self-awareness, this complete other dimension that contributes to not only health and a quick fix, but a complete life transformation. So my journey and my message is this. I believe the Western healthcare model is assembled around fighting and having a war against a particular disease by just simply offering a solution and throwing somebody back into life once the surgery is performed or the organ transplant is implemented. I believe that I have seen a level of disempowerment that has followed the patient through on their journey, sometimes to the end of their life, not really understanding why this happened to them or having a real proper way to integrate the experience as an opportunity for spiritual and personal transformation. So I would like to open that broader conversation of illness as a transformative measure and also hoping to avoid and do more prevention of the illness in the first place.
Wonderful. Thank you very much, Stephanie. And here we also have Scott Gordon, a philosophy-based counseling researcher, counseling trainer and consultant, school teacher, and philosopher.
Thank you, Corey. My name's Scott Gordon. I'm a semi-retired school teacher. I've taught in public school many years with awards, and also am now teaching private school online part-time. As he said, I'm a philosopher and very interested in philosophy, and I'm also a counselor. I like helping people. So I put those two things together in a philosophy-based life improvement counseling. And I'm a student of psychology, philosophy, knowledge, and I'm very interested in the interaction of mind, body, and spirit. And so my interest in this is the interaction between the body and the mind and the spirit. and how those three things work together and are reflective upon each other, and how I can shape my counseling to help someone who's dealing with physical issues, as well as how I can read physical issues as possibly something reflected in the mind or in the spirit. So it's a fascinating subject. I'll probably never get through it in my lifetime. So I'm a research counselor interested in developing more in that area. And I'd like to introduce our hardworking, responsible, bright young leader, Corey Endrelot.
Thank you. Yeah, I'm an integrative nutrition health coach, author, researcher, philosopher, event organizer, and project manager. And I welcome you guys. I thank you all for making your introductions, and thank you everybody who's joining us here as well for your expertise and your time and attention. As I've said before, this is very important information. I'm glad to share it with you. I'm an author of several books, actually, one of which is called Natural Intelligence, the Technology of Peace, where I collaborated with some of the world's leaders in industries, such as Marjorie Wildcraft and Joel Salatin, who are best-selling authors, and Jim Gale, Rowdy Mayer, he's a successful land developer. We have great people among the networks that we are sharing unique solutions through a lot of my works. So our intentions and goals, I want to make it clear that this is a presentation for everyone, both practitioners and patients. And we are here to share information based on reasoning and evidence, in addition to an intuitive and experiential perspective. We are to encourage discussion around what we deem as a grossly overlooked issue, and to highlight that more scientific research has yet to be done, that this is an evolving work.
So let's just get into what we are not, just so we're clear. We are not a self-iterating, institutionalized, or overly academic forum for self-promotion. We're not a healthcare entity, simply people who truly deeply care and have witnessed what needs to be shifted. We're not bitter, and we're not blinded by our own bias as much as possible. Throughout this creation of this project, we have faced our own little debates amongst each other, and we're always open to more ways in which we can be aware of our own shadow elements. We are not a collective of healthcare workers and patients separated and siloed away from each other. So the perspective is narrower. We try to broaden ourselves and make ourselves uncomfortable with these diverse opinions. And we are not making any money from the sharing of this information. This is solely coming from our minds and our hearts to try to give back this information that we believe will help to transform the way we move forward.
Quick disclaimer. All contents in the seminar or on the slides is not intended to provide healthcare, medical, or nutrition therapy services. This is for education purposes only, not to be construed as medical or legal advice. We need to say this for the presentation purposes, putting this on the internet. And to start off with a quote here, when I criticize a system, they think I criticize them. And that is, of course, because they fully accept the system and identify themselves with it. It's a quote from Thomas Merton, an activist.
I'd like to make a comment on that for a moment.
Please do.
Because I want to normalize that reaction when we care deeply about something, when we embrace our identity as a professional. It is very easy to feel defensive about our work and our colleagues and the system that we work in. That's very normal. So I expect that, you may feel some of that defensiveness or perhaps offense. So I encourage you all just to take deep breaths, to keep your minds open throughout this process, and just stay present with the information, because it will add upon itself every bit of information we share throughout our series. And it is in getting that whole picture that you'll start to perhaps see some of the logic and wisdom of what we share.
Thank you. Here's another quote from Carl Jung, a psychoanalyst, who says, "It is not famine, not earthquakes, not microbes, nor cancer, but man himself who is man's greatest danger to man, for the simple reason that there is no adequate protection against psychic epidemics, which are infinitely more devastating than the worst of natural catastrophes." So we'll be exploring some of these ideas, introducing this seminar here with these quotes. But first, we want to start off with some statistics. The problem of trust in the medical field. Here you have two different charts, and you have the reasons from patients and the reasons from physicians regarding mistrust in the United States. So you can look at this chart here, and you can see on the left-hand side, the top reason for patients having mistrust in their doctors is they say they spend too little time with me. They do not know me. They do not listen to me. And then they do not give me all the information. They are too financially motivated. And then there's even some folks who say they do not make eye contact with me. And then there's other reasons. As for on the right side, we have a chart talking about physicians and why they think their patients have mistrust in them. They think it's poor communication, high costs, challenges with insurance coverage, being treated differently by demographics, perceived economic self-interest, misdiagnosis, or medical errors. I encourage you to look over these charts that we're sharing here during some of these statistics.
I'd like to share something here that I think is very important to highlight and a theme to follow throughout our whole presentation. And this is the importance of trust in the health relationship, and that trust is a two-way street, at least. Humans are naturally relational beings. We're relational creatures, especially in matters of health and survival, which healthcare is very connected to our well-being and our sense of aliveness, of being safe in the world. And so this relationship goes two ways, not only patients needing to trust their providers, but providers needing to trust their patients. And then we have an added area of trusting a third party, a third thing that is very much a part of the healthcare system and the government policies and healthcare and insurance companies that impact this system.
Yes, there's a lot of facets to this that we need to explore. Here's a chart saying, how trustworthy do you consider each of the following to be as spokespersons for medical and health research? So you can see there's different categories here for scientists, public health officials, family and friends, the federal government, some of the things that Leslie just mentioned, in fact, online medical forums, TV, radio, podcast, right? What do people consider as trustworthy information? This is just important to bear in mind as we move forward.
Just because I agree with Leslie, and there's a reason this slide of trust is so prominent in the beginning of this conversation, because this is essential for not just a good relationship, but to have the potential for healing. Is you need to be in a coherent relationship that's trustworthy. You need to feel like your provider actually cares about you. That's a big part of opening a potential gateway towards healing. One thing I wanted to mention is, because we have these complications right now, is that we're cycling with a lot of confusion amongst that triad that Leslie mentioned, which is the system, the provider, and the patient. And because we all have levels of frustration, at least the human beings that are involved within this system, we get caught in blaming and shaming different aspects of this triad. So you'll see the patients blaming the providers. They don't care about me, or they're not good. You'll see the providers behind closed doors critically judging their patients. And then the last one seems to be where we're at now, is everything's the system's fault. So we need to really get clear as we proceed so we can create that relationship that we all need to promote health and wellness.
Yes. And we have a problem of addiction in the world. The medical professionals and substance abuse statistics here you can see on the left-hand side, 20%, according to the Journal of Clinical Nursing, approximately 20% of all nurses struggle with an addiction to drugs or alcohol. 1 in 10 physicians will fall into drug or alcohol abuse at some point in their lives, mirroring the general population. Physicians who receive treatment and participate in ongoing monitoring have a low rate of relapse. One study found that 71% were still sober, licensed, and employed after 5 years. And here we have a quote from addictioncenter.com. Doctors and nurses account for some of the highest rates of addiction in the workforce. So this is just one of the problems that we are addressing here that we're highlighting.
Yeah, and I think that this reflects the level of stress in the healthcare industry and the pressure and stress that healthcare providers are facing in their work, and perhaps also the lack of personal support around their own mental health and their own coping strategies.
Yes.
Yeah, just to add on to Leslie for one moment, is that's a very important slide, Corey, if you could just return to it for a second, because in addition to this is physician and healthcare provider suicide, which we didn't add in the statistics, but throughout medical school, you see this happen in almost every medical school.
Wow.
And so we need to just hold that space of compassion and love for everybody who is a healthcare provider. Is that I personally have not gone through that training, but we hold love and care for the type of training that you've been through. If it's felt militaristic or you haven't had time to sleep, eat, or take care of yourself, we really hold that compassion for you. And we're encouraging that you get the care that you need as we proceed as well.
Yes, absolutely. And we have an evident problem of obesity as well. 4 million people die each year as a result of obesity, according to the World Health Organization, and the worldwide obesity rate has nearly doubled since 1980. Based on data collected between 2017 and 2020, 41.9% of adults in the US have obesity. These numbers are quite staggering. You can even see charts from the CDC where they have to change colors because of how much this rate has increased. Medical costs for people with obesity in the US tend to be around 30% to 40% higher than those for people without obesity. So these are just some statistics to bear in mind. This is where we are at moving forward into the world. Before we sort of address these problems, we need to know, where are we? Where are we in our current day and age?
I think that this problem with obesity is a very complex one. And I wanted to highlight that in medical school, nutrition and holistic wellness, lifestyle habits are not the emphasis of their training. I've heard that there may be one nutrition course typically, right? So this isn't their wheelhouse. The people whose wheelhouse is nutrition are generally alternative providers. And there's often a disconnect between the mainstream medical system and those alternative providers. And I also want to highlight here this is also an issue of trust that I've heard from providers, where even providers who are very aware of the importance of lifestyle change and are encouraging their patients to make dietary changes get very frustrated because their patients often are not following through on those lifestyle changes. So this is one of those factors that affects trust in both directions. And I also think we have this issue again of embodiment of these behaviors that create health. And a healthcare provider each one is at a different level of their own embodiment of nutrition and health. So let's say, if as a therapist, if I'm in the middle of a really bad marriage myself, I'm not going to be the best marriage therapist, right? So a provider who hasn't mastered this part of their life may not be the best, may not be bringing up these issues related to obesity as effectively as others, right? So I just want to point out these subtleties related to the topic.
Stress collects around trauma, and you're going to have workers that get stressed out according to how much trauma they have. And one of the reflections of that would be obesity, if not addiction. Sometimes those do go hand in hand. So yes, addressing trauma, addressing stress would be important both for patients and practitioners.
Okay. We also have an evident problem of medical errors and medication errors. The US FDA receives over 100,000 reports of medication errors each year. 41% of US citizens have claimed to be the sufferer of a medical error. Sometimes this was a personal encounter or from watching it happen to someone else, like a family or friend. Every year, there are 7,000 to 9,000 Americans who die from medical errors. Approximately 530,000 injury incidents occur yearly in outpatient clinics due to medication errors. 10% of the patients in every hospital will be part of a medication error. So this is another thing to bear in mind moving forward.
Yeah, I'll just briefly say something on the medication piece. And this isn't exactly an error, but it is a medication discrepancy that we have generics of, we have name brand pharmaceuticals and we have generics. And one of the things I've recently learned is that the generics can vary tremendously from the name brand and between each other. So some of the generic medication is being put together overseas where there's different levels of accountability and over the process. And so I've had clients who have been denied, let's say, a name brand drug given a generic and had side effects and problems with their experience with that, not being effective. So this is, there's a human element in all of this. So we have to keep in mind the human element of error when it comes to pharmaceuticals and any kind of procedure.
This is a personal experience, just to add this in, because I think this is probably more familiar than we'd like to admit, is that I've had a family member who has been on multiple medications, and she wasn't an elderly person. And I remember speaking to her about her medications and how she was feeling. And I would ask her, what is this for? What is this for? What is this one for? She didn't know. She didn't know what each of the pills were. Sometimes she would forget and she'd say, well, I assume I can just take this. There was a lack of true, not just accountability on her part, but when you're giving people types of psychiatric medications, it's easy for the human to get confused. So there just has to be an overall better, we have to do a better job with all of this, in my opinion. So I'm sure she's not the only one who experiences that. She doesn't know why she's taking her medications or what they're for specifically.
And add on the risk of error when a provider has an addiction problem or substance abuse problem. And I've heard, many examples of, let's say ER nurses who go out and drink, after working a very stressful shift, and there's all sorts of stories that can help us understand how these errors occur.
Yeah. And Leslie, just one last thing is what you just reminded me of is that a lot of these issues, they are human. They're not patient or provider. If you are, if you have addiction or you've got some, some of these issues, it's not, we can't keep separating and creating this hierarchy between these issues between patients and providers. It's a human issue. And we can't pretend that just because somebody has a healthcare license, that they have a hierarchy if they're experiencing the same thing and suffering with the same things that some of their patients are dealing with.
We also have an evident problem of autoimmune issues. A population-based study of 22 million people shows that autoimmune disorders now affect about 1 in 10 individuals. A 2023 study found that 19 autoimmune diseases affect about 10% of the population, with 13% of women and 7% of men affected. This is higher than previous estimates, which ranged from 3 to 9%. And so a lot of these statistics, you see there's a general increase of these problems. So what is happening, right? Are we treating these problems? Is there something going wrong in this process? We're here to sort of reveal this for everybody.
Hey, Corey, I have something to say about this slide. I was diagnosed with an autoimmune disease when I was 19. And the most recent statistics are, I believe it's over 85% of people that have autoimmune diseases are women. And they are starting to understand the profound link between trauma and stress and an autoimmune response for women. And obviously, once you have one autoimmune condition, I think they said usually within 2 years, you can have up to four. So they start to combine these multiple diagnoses. When the immune system starts to turn on itself, it starts to just go through a host of these different conditions. So we're seeing a massive, massive rise of our own immune system turning back on in itself to destroy ourselves. And that's a big problem.
Yeah. And it's a problem that leads both providers and patients in utter confusion and frustration, and feelings of helplessness and hopelessness, and sometimes even feeling a lack of trust in oneself. If your own body is turning against you, how, do you trust yourself, right?
Yeah.
And your natural ability to heal. So again, this trust theme is rolling through every one of these issues.
Just to end on an experiential note, when I was 19 and I was deteriorating physically, and I was apparently a pretty healthy looking woman at the time, ate well, vegetarian, clean diet, practiced yoga, but I had all of this symptomology and I was very confused, very lost, felt very betrayed by my own body. And when I went to a multitude of providers, I was getting misdiagnosed because they couldn't quite figure out exactly what was going on with me. And I even had people tell me that maybe it was psychological. Was it near my period that this would happen? So there was just a lot of confusion around it. But I will tell you that in the first year of my misdiagnosis journey, I probably had seen maybe 7 different doctors. And within the first 5 years of my autoimmune condition, I had one provider who was actually he was a hematologist. He was a blood doctor and had nothing to do with the rheumatic part of my condition. He wasn't an autoimmune doctor. He was a blood doctor because my blood was a mess. And he came in and sat with me. And this was probably about 2 years into my process. And I was exhausted. I didn't know what was going on. And he sat down with me and he looked me in the eyes and he said, "How are you?" And I said, "Well, like my blood work says this and my labs and my blood pressure." And he said, "No, no, 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 Stephanie. How are you? What is your environment like?" And I immediately burst into tears because that was a root cause of this, I believe, in initiating in the beginning. But it took that long and that much suffering and pain and me feeling lost before a provider cared enough to ask me a deeper question that maybe actually had something to do with my disease.
Wow.
Yeah, and it really highlights, Stephanie, how important the relationship is between the patient and the provider and the sense of trust to be able to be authentic. And problems such as autoimmune issues are very they result in emotional experiences of the person who's struggling. And some providers are more comfortable with holding that space comfortably with emotion, and some are not. So, and that's not a high level of training in most medical schools either, how to deal with emotional issues.
I actually said to my provider about a year later, I went back to him and I said, "I've come to understand that you are the only provider that has asked me beyond the norm. And I want to know why, like how like I think so highly of you. What made you think of that?" And you could tell that he had a high level of self-awareness, that he wanted to face the difficulty of what was beyond just the labs. You could just tell that this gentleman's character, he wasn't afraid to go deep because obviously he then exposed to me that he had some major complications amongst his own life experience, which helped him to open up to the complex nature of how our mind and emotions really do play into our illness. So if a provider has not yet had that level of complexity or suffering within their own personal experience, there's a schism between them truly helping a patient through an experience and just simply providing treatment because they have yet to understand what suffering is within themselves.
Thank you guys for sharing your experiences.
Mhm.
Amazing. And we have an evident problem of autism as well. So we're going through all of it here. The latest research in 2023 from the CDC shows that 1 in 36 children is now diagnosed with autism. This is an increase from 1 in 44 children in 2 years ago. Since the report was recently released, the data is likely to stay the same through 2024. 1 in 36 kids are identified with having autism. This is 241% higher than baseline statistics from 2000, which was 1 in 150. So pretty staggering statistics there.
And we are left asking the question, why?
Yeah.
And I don't think we have a good answer. There's a lot of people proposing potential answers or reasons, and most of them are environmental, or possibly some people are finding connections with autism and immunizations, some with exposure to GMOs or glyphosate. Um, I've also heard around candida. So where people are really seeking answers to this, and we're still not sure.
Mhm.
Yes. We also have an evident problem of infertility. You even see people like Elon Musk talking about this very publicly. Infertility rates are generally rising globally, with the World Health Organization reporting that approximately 1 in 6 people worldwide are now affected by infertility. 51% of individuals reported feeling dismissed by medical professionals when discussing fertility struggles. So here we see a statistic and then a disconnect between the patient and the provider in relation to a world issue. We also have an evident problem of cancer. The number of new cancer cases is projected to rise significantly. In 2024, an estimated 2 million or so new cancer cases will be diagnosed in the United States, up from 1.9 million in 2022. Globally, new cancer cases are expected to increase from about 20 million in 2022 to 35 million by 2050, a 77% increase.
That's scary. For
Yeah.
most people reading this will become frightened. My experience with talking to many people is that cancer is the scariest thing that medically that could happen to them. Just and there, I've noticed a rise in health anxiety, and with cancer being an immediate fear, anytime someone has an abnormal somatic feeling, right?
Mhm.
Running to
Yeah.
the doctor. Yeah.
Leslie, I would just like to say, in addition to the autoimmune and the cases of chronic disease, something like cancer is something that causes a fear often within us because it can return. So I've seen that a lot in the organ transplant community is every time I get blood work, when is my organ going to fail? So these conditions, not only being horrifying, I think that what's happening is this increase of fear and the return of the disease is not letting us fully project into our possible healing because we're not really letting go of the fear of unhealth. We're not really stepping into health because that fear is always lingering there. So definitely a problem.
Yeah.
Yeah.
And many of these health problems that we're highlighting do have environmental correlates or lifestyle correlations, so that there are behavior changes that are correlated to health and reduction in risk. And yet there's likely that third party, which is outside of the patient-provider relationship, that is influencing these rates of increase of cancer, whether it's environmental or other. So.
Yes, we're going to dive deeper into that. The evident problem of mental health as well. As of 2022, 32.9% of US adults experienced both a mental health condition and substance abuse. 6% of U.S. adults experienced serious conditions. As of 2020, and we mentioned this one before as well, suicide is the second leading cause of death for U.S. children ages 10 to 14. So it's not just medical providers. We're talking this is systematic all throughout society. Suicide rates overall have increased by 36% between 2000 to 2021. Depression and anxiety cost the global economy about $1 trillion each year. In 2021, 51.7% of U.S. women and 40% of men received mental health services. Young adults have the highest rate of mental health concerns, around 33.7%, and the highest rate of serious mental illness, 11.4%, when compared with adults. 42% of adults with a diagnosable condition could not afford access to treatment they needed in 2023. 93.5% of adults with substance abuse did not receive treatment in 2022. Goodness gracious.
This is heartbreaking. It's a collective heartbreak that we are where we are. If you don't feel that, you may have become apathetic, because this is truly heartbreaking.
Yeah.
Especially when we see the impact on children and young adults, the future.
Mm-hmm.
And that there's a lot of suffering, and a lot of the children, they are the most vulnerable, and they can't really speak up and advocate for themselves. They don't have the ability to understand what's going on. So there's a lot of reliance on the adults of the world to sort this out.
Yes. And so, more on suicide. Over 4 times as many men as women die by suicide in the US, and suicide rates increased by 36% between 2000 to 2021. Suicide accounted for around 48,000 deaths in 2021, which is approximately 1 death every 11 minutes. So just a bit more on that. But here's a quote. And before I say this quote, I just want to say, going through these statistics, it is very heartbreaking. I'm pretty sure everybody out there, myself included, we have friends, family, or even ourselves who have dealt with some of those issues that we covered. And this seminar is not your average seminar in health. There's plenty of people who talk about those problems. They talk about those statistics endlessly. But we're here to say there are solutions. And so here's a quote saying, though the problems of the world are increasingly complex, the solutions remain embarrassingly simple. And this is from Bill Mollison, who's a founder of a little-known philosophy in gardening, actually, in agriculture, called permaculture. And so he found solutions that a lot of other people were not looking at to doing things better. And we want to show you a lot of solutions as well, but for what we're talking about. And so, talking about the problems and the solutions, let's understand why we have a failure of medicine. Many health practitioners in recent years have lost or have had to step down from their positions. This might tell us some clue. It is also that doctors want transparency. The patients want transparency. We can see some headlines here. Medicine's Great Resignation. 1 in 5 doctors plan to exit in 2 years. Doctors leaving profession at higher rates than before pandemic. So, there's a lot going on right now with the medical field. There's also burnout in the medical field. And there's a book called Burned Out by Dean Mafako. Sorry if I butcher some of these names. And it's a compelling novel that delves into the medical profession with its pervasive issue of burnout. There's intense workload, emotional exhaustion, systemic challenges, and personal sacrifices that are being taken here. There is relentless demands of patient care, long shifts, and high-pressure situations that take a toll on doctors, nurses, and other staff. Healthcare workers often face emotionally charged situations, witnessing suffering and loss. This emotional burden accumulates over time. The novel hints at systemic issues, staff shortages, bureaucratic hurdles, and resistance to change that exacerbates the burnout. And then characters sacrifice personal lives, relationships, this is in the book, and the well-being for their profession, emphasizing the cost of dedication. So when people are dedicated to something, there is a sacrifice, but at what cost is the question, right?
Yeah, I'll add a personal experience and something I've heard from others is related to this burnout. Because of the financial aspects of keeping afloat health centers, there's often quotas or targets of number of clients to be seen in a certain amount of time, right? So therapists may be threatened, their jobs may be threatened, for example, if they're not seeing enough people, and also I have an experience of a nurse who was a bilingual nurse on a nurse line, a phone line, and she was given very, challenging levels of phone call quotas that she had to have within an hour. And so the focus of her job, the measurement of her job performance was on how many people she saw, not the quality of the care she offered. So she would try to stay present with people to help them, but it might take too long, and then she'd get in trouble for spending too much time trying to help people. So there's a lot of catch-22s where this very human-based work is being measured in kind of inhuman ways. So.
Yes.
Yeah, I would like to just add one quick thing to that, Leslie, is I've worked with some providers on a personal level, and they discuss and share very openly the excitement and naivety of a young provider going into the field. And when they start med school, how excited they are to just be of service and be aligned with their calling. And by the second or third year, the physician actually said to me, I can see their soul leaving their body. And that's just it's very, very deep comment, but I think this is what we need to start to actually address some of the underbelly of the performance, like you said, and what that truly is doing, not just to the provider, but then the person they claim they're in service to.
Mm. Yeah, like that's more questions, like what is actually happening here in the medical field that's causing this to happen? And what are the solutions? We're covering this as we move on here. Here's more statistics talking about burnout and different things that are going on here. Stephanie, if you want to expand on some of this, perhaps.
Sure.
We
Yeah.
have gone over some of these as well.
Yeah, I mean, obviously, anxiety rates are increasing all around the board. Patients, providers, administrators, anybody involved. I know people who don't even want to be involved in the healthcare system anymore because it's like a maze of confusion and they just feel anxiety when they have to even call to make an appointment because of all the bureaucratic blocks. And if you do have an illness, often it becomes like a part-time job or even full-time job. So then we have burnout and compassion fatigue. I've literally been hired by providers to provide their patients emotional support because they've said to me, I don't have the time to do this and I don't really understand. Can you sit as a peer and provide patients with emotional support? That's important. We shouldn't be just doing this on the down low. This is something that needs to be brought up collectively so we can have a change. Issues with couples, obviously, stress reactions. And then back down here, you have physician burnout. I don't know many physicians who don't feel burnout unless they are completely checked out with the current collective narrative. And you do see that, sadly, certain physicians or people get labeled, the egoic surgeon or the narcissistic, the person who is just on autopilot, so focused in what they're doing that they're out of touch with the collective reality of the people getting the services that they receive. But I know almost every single provider does feel tired, low energy. And then what does that lead to? When you're low energy and you're burnout, you have to you have to replenish yourself somehow in some way. So either that's going out and over consuming to somehow reclaim that balance that you've lost throughout the week. And sadly, we've normalized this behavior, right? The grind culture, it's the war culture of, oh, I stayed up for 48 hours straight in my shift last night, but I'm really going to party this weekend and I'm going to go to Vegas and I'm going to get some hookers and then I'm going to come back and I'm going to be good to go. This is not a healthy culture.
Yeah.
And this is a reality that I've heard a lot.
Yes, I agree, Steph. And that pressure for productivity leaves very little time, almost zero time in between patients or clients for a provider to even look within and evaluate the impact of what they just experienced on themselves. And so, when you're pushing from client to client, patient to patient, seeing a lot of very stressful, traumatic, seeing and hearing a lot of traumatic things, and dealing with frustrating circumstances, where does a person process that? The agencies and healthcare agencies themselves don't do a lot of provision of a place for providers to process or even do the after something stressful happens, it's really important to kind of go back and like talk about it. Or else the provider themselves is at risk of a secondary post-traumatic stress response.
And
So
here's
this,
where we see a need for a therapeutic solution. Most people think of going to your psychoanalyst for sessions. Doctors usually don't have time to do that. And then there's the other solution on the other extreme of leaving it to going out and taking vacations as a solution. That doesn't necessarily address the stress picked up on the job, doesn't necessarily address the burnout that the physician is going through. So we need therapeutic solutions that are tailored to the professional or to the patient. This slide is not about the patient, but we'll be getting into that more. Therapeutic solutions that are not so drastic in terms of taking a commitment of time. Little tips that people could do with a journal and by themselves to go a long way, would go a long way in alleviating some of the stress and processing some of the stress that's contributing to the burnout.
Great point, Scott.
Yeah. And here you see more statistics here, why physicians and providers are seeking support. And so they're providing their reasons. We have it all. This information is all out there and public. And again, many people go over these problems, but as Scott has mentioned, we want to look at the solutions. What are the ways, the modalities that we can apply within our practice or within the world and society as a whole to help these conditions? Because clearly it's not just happening with the medical field, it's happening pretty much systematically based on these different statistics.
Hey, Corey, real quick. I think what we're proposing, and in the hopes of our presentation, is to provide some transformational, sustainable results. We're so used to getting a quick fix to feel better and having that hit of relief, either a pill for a patient who's in pain or a quick weekend vacation for a provider who's in pain and stress. And I think what we're really trying to promote here is a shift in the way we're operating the system so we can all have more access to sustainable energy and not have these ups and downs and highs and lows and quick fix-its to try to survive in life.
Yeah. And, here you have more ingrained stigma, projected physician shortage. We mentioned that before. And suicide, mental health. These are just more statistics confirming some of the things that we mentioned before from various sources. And so what we're seeing is a convergence in health. Many health practitioners and experts, professionals have converged into topics concerning natural, functional, integrative, etc., medicine, freedom, spirituality, law. Many have lost or had to step down from their positions. So people are exploring different avenues. And here's just a list of different doctors, practitioners, and there's plenty of more that we did not mention here. This also does not take into account the countless naturopathic or holistic doctors who have stepped down, or people who have been attacked, or people who want to see change in the system. Doctors want transparency. The patients want transparency. We said it before. We'll say it again. We see a whole list of practitioners. What is going on here?
Hey Corey, I'd love to Scott, I'd love to put you on the spot with a psychological perspective. I would assume that most healthcare providers understand full and clearly of what we all just expressed. From a psychological standpoint, why do you think there is resistance to getting help from alternative communities?
Well, that's a good point. It's been stigmatized. We live in a pharmaceutical world that dominates a lot of the medical education and the marketing, and including even influencing what we're watching on our programs now because they pay for the marketing of the program. So we're seeing a kind of a covert or a sneaky stigmatizing of the whole area of doing something alternative or doing something different or doing something healthy that one wouldn't need to get a prescription to do. So that's unfortunately where we're at.
Scott, can I just ask you to dive a little bit deeper on this? If a physician who's taken an oath to do no harm and to truly care about a patient, what do you think is going on psychologically that maybe somebody would want to hinder more opportunities for their patient? How do you think somebody gets to that place where they're putting the kibosh on other things that maybe can help them in lieu of solely having it their way?
That's a good question. And again, I say there's a lot of different influences. That's the main one that I mentioned, but that sets all kinds of other influences into motion. That's a huge one. And medical schools and cultures come together and sort of lining up underneath this huge influence. And they're perhaps seen mainly as competition or people who remind me that I know I'm doing something that's maybe not completely correct, that may not be the least harmful method, but it's been, the system has converged and made it this way so that there is a dividing line, unfortunately, between that's why they call it alternative. Your mainstream care is your mainstream care, and it's thought to be the science that everybody should be doing, and we shouldn't be paying attention to these alternative practitioners.
Yeah, I'll add a personal story that demonstrates some of this. My son was dealing with stomach pain, chronic stomach pain, and was concerned he might have had a hernia. And this was actually during the pandemic, and we were refused entrance to one clinic because I had gone hiking an hour away from town, and they decided that was unsafe for us to enter. So we had to travel and find another clinic where they would actually see him and physically touch his stomach. And the provider basically had to say, from her medical hat, she couldn't really give any solution to the problem or necessarily identify a diagnosis. But off the record, she could identify this as possibly an IBS, irritable bowel syndrome experience, and that she recommended that he do some like a fast and with bone broth. And she said this was something she dealt with and that helped her. But she highlighted that there was a real kind of difference between wearing the medical hat and what she could say from that umbrella to taking it off and saying it off the record. And I think that many providers are in this dividing line, right? Like Scott, you said, between what their license and their boards say they can diagnose or treat and what they may understand on a personal level, or their personal experience. And so a lot of these people on this list are people who are on cutting edges, who are open to holistic and alternative perspectives that were somewhat demonized for speaking out against the mainstream narrative or the narrative being promoted by the state medical system. So there is this fear. There's an aspect of fear, if you want to, the question of why are providers holding back. I think that there's a level of fear that it does touch on their own survival because it touches upon their livelihood.
Yeah.
Hmm.
What
I'd like
about,
to just
sorry, I was just gonna say, what about like the scientists? What about the smaller healthcare workers, the nurses? I mean, we could expand this list almost indefinitely. These are just some of the ones we came up with, but my goodness, there's probably way more out there.
Mhm. Just as an experiential add in, real quick, is that because of my lengthy experience in multiple prestigious institutions throughout my health journey, is I came to understand very quickly the nature of this suppression. And basically, I knew what I had to do to get the care that I needed. I knew who I had to show up as to try to establish and kind of force that relationship right away. So I actually felt like they cared about me. And many times, Leslie, to your comment, I would go in and ask somebody a question of, well, do you think I should do this or that? And I would say, please just respond to me as if I was your daughter. Because I felt as though if I couldn't put them in that psychological framework, I didn't know if I could trust what they were saying.
Wow. And so we have a great interest actually in alternative medicine rising in the world. Complementary and alternative medicines market research report. And this is by type, and you can find out more about this if you'd like. We have the link there. A global industry analysis and forecast 2024. And you can see there's nature-based practices, mind-body intervention-based practices, manipulative body-based practices, energy-based. And how familiar are you with some of these practices is perhaps my question to you, any practitioner listening, or even any patient, anybody out there looking for care. Are you familiar with any of these modalities? Why are people using them still, right? Perhaps they've been used long ago. Are they still relevant now? Can they be proven with science? Can they help people get out of these problems that we seem like we just can't fix in today's world?
Hey, Corey, I'd like to quickly add something that I feel is important. When I bring up alternative medicine to my providers, the initial gut reaction is, I can't have you taking any herbs that might interact with your medicine.
Mm,
And so I think that there is a lack of understanding of what holistic medicine and care actually looks like. And also, if we are afraid to start to integrate this relationship, I think the lowest hanging fruit is that most of these therapies provide your patients with an incredible amount of healthy stress release. And if you care about your patient, suggesting something that can help them reduce their emotional burden and stress that you may not have time to deal with, I could only imagine would be a benefit to everybody involved in that care process.
And Corey, you asked the question, can these modalities be studied and their effectiveness measured? And I want to ask the question, are they being actively studied in our mainstream medical setting?
Mm-hmm.
And I think that some of these are more so, like psychedelic assisted therapies is starting to become studied and mainstreamed to some degree. But for many, many years, like for example, acupuncture was just not being considered. And so hopefully these trends will change. Sadly, though, with recent events, I'm seeing a trend in the other direction of pushing this stuff away
mm.
Yeah.
and a more territorial nature
Yeah.
about mainstream medicine. So.
Yoga has been studied in meditation for quite a long time at some prestigious institutions. And again, they have shown really promising therapeutic effects for stress reduction and even increasing gray matter of the brain. But we are in this very tricky time with our languaging and people calling out different nuances of different practices. And I've actually seen people more recently attacking meditation and attacking things like yoga, saying that it can open up a deep, more psychological problems. So we live in a tricky time, and we need definitely to return to some sort of clarification and coherence.
Yes.
So
Yes, and I want to make it clear for the viewer too that what we're sharing here in the seminar is not limited to just like, hey, here are these modalities that are different from the mainstream. It's a whole different approach, a whole different way to look at the world. And actually, I would argue that what we have to share in this seminar is not even understood by many of the alternative medicine practitioners either. So we have quite a bit of information I think will benefit everybody in the medical field.
Yeah. So I'll just share another example of a modality that can be very, very helpful for people with, mental health challenges, and that is neurofeedback, a relative to biofeedback. But neurofeedback is directly measuring and working with feedback mechanisms to help manage the the mind, and the levels, your delta, gamma, beta, theta states, and so forth, and helping create more adaptable neurological networks, for resiliency. And it's very inconsistent where you can get that paid for through insurances or healthcare. And in fact, there's a lot of barriers to people accessing it. Even in a big healthcare, the main healthcare provider, Kaiser in California, does not pay for neurofeedback. And yet I've been an employee, I've worked at a smaller healthcare center where they were able to work it out so that their psychiatric nurse could provide that service. And I've seen people make drastic improvements, and it's been a great complement to the psychotherapy work. So there's just one example of something that's pretty well documented as well in research.
mm-hmm, mm-hmm.
Let me point out also that a lot of people are not aware that the development of Freudian psychotherapy originally came from the healing of a woman who had been returned to her childhood and had released some of the trauma and had experienced a healing that she wasn't able to get with regular medicine at that time. And that was a lot of the excitement of the development of that therapy. So a lot of these alternative practices, if they're not energy work, which is, we know that the organism is a bioenergetic field, have to do with either talking or representing something of trauma or stress and being able to exchange that and release the stress. So those are all valid therapies as well and can contribute to healing.
Good point, Scott.
Yes. And so thank you guys for joining us for the introduction. Again, where we are and how we can then move into the future. We're going to be talking about the solutions and the different aspects to how we can shift the current paradigm, the current system to the future paradigm that we believe is totally possible based on our research, based on our statistics. And so we're going to go more into defining, observing, and analyzing what we are currently at and how we can move forward into that better world. So now is a good opportunity for you. If you'd like, we're going to take a short break ourselves as well. If you want to go and get some tea, some coffee, anything to munch on, this is a good opportunity to do so, or simply reflect on what we have shared thus far before moving forward.